Olive View Medical Center, and thank you for tuning in. This is the first episode of The View, of this bi-weekly program that you will get your information, your announcements, your communication. We'll answer your questions. This is your show, and I'm here with Brenda. You want to say hello and introduce yourself, Brenda?
Hi everyone, my name is Brenda Yanez. I am the Public Information Officer here at Olive View, and I'm happy to be here today to kickstart the first episode of The View. Thanks,
Brenda, for being here. Before we start, I just want to acknowledge that we're still dealing with these wildfires here in LA County, and some of you have been either directly or indirectly affected by these fires. But for those that are been affected, I want to give my sincerest gratitude and thanks for coming to work. Some of our staff had stayed over during when we had that fire crisis that was happening down the road here. They were able to stay longer. Some folks, even though they had evacuation warnings, were still coming into work. I just want to thank you for your commitment to our medical center, our community, and patients. And so if there are support resources that are available to you offered by the county and also DHS, and please contact your supervisor if there's a need for support with housing, support with resources. Please let them know and we can connect you to those resources. And for some of you might not even know who I am, and so let me introduce myself. I know I've met many of you. I've been here for almost 3 months now. Feels like longer, but that's a good thing. It feels that I feel right at home here. But my name is Edgar Solis. I am a registered nurse. I've been here for the last 3 months, and I am the Chief Executive Officer. So my background, I've worked as a nurse for a long time, various leadership roles in different facilities, both private hospital and public hospital. Most recently, I was the Chief Operations Officer at Alley General Medical Center. I'm happy to be here. I'm excited to be here. And I'm really, I've met many of you through different various events, most recently the holiday meal event that we had, some of you at the pediatric holiday event. And I was even here for the costume party, the costume contest.
The Halloween costume.
Yeah, and it was an amazing event, something that I haven't seen. I just love the participation. So you'll see me next year in October. I will also be participating in the Halloween contest. But this is The View. This is our social media presence. Do you want to talk a little bit about some of the plans that we have for The View?
Yeah, so this is going to be our new communication platform, and our goal for this is to basically improve and uplift our way of communicating with all of our staff here at Olive View. It'll allow us to engage in transparent conversations, and will really provide us opportunity to engage in a different way with you all. So we're very excited for The View coming to live. In terms of frequency and format, so we will be rolling out these videos on every 2 weeks, and they will be uploaded directly to our YouTube channel. It will allow us to be much more engaging with all of our staff. The View will go ahead and replace all of our CEO weeklies. So a lot of you should have already received that email with our last CEO weekly, and letting you all know that this will replace that. So we'll be able to provide you all with different campus-wide announcements, updates on different initiatives and their progress. We'll be able to recognize our staff in a whole different way, and really let you know about all the different cultural celebrations we will be hosting the rest of the year. And Edgar will have the opportunity to invite different guests as we move forward with these episodes. So who knows, you might be one of the next participants and guests here on The View. So we're very excited.
I'm fulfilling my YouTuber dreams. I've always wanted to be a YouTuber, and so they're giving me the platform to do so. But really, this platform is for you. You will also have the opportunity to submit questions, and we'll answer them here live. whether they're easy questions or difficult questions. We're here for that. Again, this is to support that bi-directional communication between leadership and staff, and to broadcast all the great things that all of you staff does for our medical center. And one of those ways to get feedback to us, we created a feedback button, right? Mm-hmm. And this feedback button will exist in the intranet. And Brenda has worked with IT. By the way, you're not seeing it, but behind the scenes, we have a lot of folks helping us get this on, and we'll introduce them later. But why don't you tell us, Brenda, a little bit about the feedback mechanism that we have?
Yeah, so this is completely new again, and it's part of this new communication strategy that we're implementing here at All of You. So we really just want to, take a little bit of time to let you all know that we value our staff's input in shaping a better environment here at All of You. So we really want to go ahead and encourage you all to share your thoughts, your questions, and suggestions for improvement all throughout. So as Edgar was mentioning, this feedback button, you will have the opportunity to submit your feedback via this button. And again, it's an initiative to increase that transparent communication across the organization. We want to be able to cut as much red tape as possible and allow you guys that opportunity to communicate with us directly. So Edgar also mentioned that it's going to be located on the SharePoint. It's going to be on the internal facing SharePoint page for all of you to go ahead and access. And the survey is available both in English and Spanish. We really want to make sure that all of our staff are participating and that they also feel comfortable in submitting all of their recommendations, questions, etc. All of those submissions will be anonymous unless you wish to reveal your identity. So if you feel comfortable in providing us with your name, your email, and your contact information, we'll make sure that we're closing that loop with you, that we're answering any questions you might have. And we just want to go ahead and invite you to use that feedback mechanism, submit all of those questions, comments, and suggestions you may have to improve OVMC. And please note that some of those questions or comments or suggestions, we will be taking them and bringing them back to the View to discuss live. So just know that your feedback is valued, and we really look forward to hearing from you all.
Yeah, it's important. I wish I could be everywhere at once and understand what's happening at the patient's bedside, at the facility level, in the environments that you all work in. But I'm not, and that's the reality. And we have plans on, increasing our presence, the leadership team's presence in these areas. But this helps us with all this feedback. It helps us improve all of you. There's maybe things that you were thinking, hey, we could probably improve. It might be very small or it might be a big idea. All feedback is welcome, both, positive or maybe not so positive feedback. That is welcome. Although it is anonymous, if you want us to circle back with you and close the loop, provide your contact information, but it's not necessary. Those questions will be discussed here. If there are questions that we need to bring experts on here to help me answer those, we will absolutely bring them there. Like, hey, Edgar, why does the power always go out when we have a wind event? That's a question that I've asked in the 3 months that I've been here. The 3 months that I've been here, there's been so much happening. We had power events, we've had wildfires, we had coyote sightings. All of you has a lot of things going on, but we're ready for that. And but yeah, this please use the feedback button. Like I said, it'll be live, it'll go live, and this is your mechanism to submit your questions to us. All right. Another thing that we're starting, like we said, we want to have more presence, more interaction with our staff. What we've started are executive rounds. Every week, the executive leadership team will be visiting a different department, a different area of the medical center, to engage with the staff and hear them directly. Hey, what's going well? What are you proud of in this department? What's not so going well? And how can the leadership team help you remove those barriers so that you can continue to provide that excellent care that you do on a daily basis? So if we haven't been there already, in fact, we're not going to be there already. There is a department we've already visited for the first time, but every week we'll be visiting a different department. So ask your supervisor knows when you'll be going next, and be prepared with your questions, your comments. because we really want that feedback as well. So last week, we visited 3D Postpartum, and they're an excellent team. The group of nurses there and physicians that are there providing services to our postpartum, the mommies that just had their delivered their babies, and they're there, and they brought up great suggestions. One of the things that they brought up was, could we just get hot water for our patients? And it's just a simple request, such a simple request, but it makes such a big difference, not only in the patient's experience, but also in, makes it easier for the care team to provide the care that they have, the necessary things that they need to provide the best care for our patients. So it's an opportunity to make those suggestions, those comments, and we will deliver. Now, so there's some, requests like we need more space or a new room, or those are a little difficult to do. But, things like hot water and things like that, that's absolutely something that we can do. But we will come in around. I also want to highlight 3D and really the maternity, the women's services that really, they got awarded the U.S. News and World Report on Best Maternity Hospitals. And that's a huge accomplishment. So huge shout out to the maternity team, women's health services team. Excellent work. This is just evidence of the great work that's already been happening for years. Now we're getting recognized for it, and we're going to continue to get recognized for that great work. So awesome work, team. And also they had they were honoring Christmas Day and New Year's Day babies, right? You want to tell us a little bit more about that?
Yeah, of course. So this is also a new initiative here at All of You. So in honor of those 2024 and 2025 holidays, we did go ahead and provide a small gift to those parents who delivered on Christmas Day and New Year's Day as a way to welcome them to the world and to the All of You family. And you'll be seeing some of those pictures of the parents and the babies soon. So we're very happy to have initiated that as well.
Is there such a thing as halfway to Christmas Day? Because that's the day I was born. I was born June 25th. So it's like 6 months after Christmas, right? So we should celebrate halfway to Christmas Day too, right?
We'll make that a new initiative.
All right. I don't think Brenda likes that idea, but we'll try to convince her. But again, great work, 3D Postpartum. Thank you for the awesome work that you all do. I like going there, especially when it's cold, because it's super warm there and it's nice and cozy. But not only is it cozy because of the environment, it's really the care that you provide. So thank you, staff of 3D. And next, we have, we want to highlight some of the past events that we've had. And, again, the View is going to be a platform where we display these pictures, we display videos of the various events that are happening. Some of you don't know some of these events are happening or haven't had the opportunity to attend. But the View will help you, actually be there by seeing these videos and seeing these pictures of these events. Recently, we had Connect with Comida.
Yes. So that's also a new initiative here at All of You, and it's an event hosted and organized by the EDIA subcommittee, and that took place on Thursday, January 16. So there will be a series of these events throughout the year. So if any of you missed this one in particular, do not worry, you will have the opportunity to join the next one. And the ultimate goal for these events is to really establish a space where we can engage in diversity dialogues, to encourage reflection and discussion on EDIA topics, and really support a workforce that values diverse backgrounds. So we really honed in on diversity for this particular Connect con Comida event, and we will be highlighting other topics as we move forward. The best part of these Connect con Comida events is that is the food. All right. Exactly. So we are providing food for the first 25 active participants, and I do say active because we want to make sure that these staff members who are attending are really engaging in the conversation and the activities that we're hosting, and that they are also bringing back a little bit of what they learned to their departments.
That's good. Anywhere where there's comida, you'll find me there. So, and for those of you that don't know what comida means food. So we're connecting through food, and a lot of folks, that's how we connect. That's I consider myself a foodie, and I can tell you I've probably tried every type of food from every different country and culture. And so if you have something that you want to challenge me with, that you feel, Edgar, you wouldn't eat this, I bet you I will. Let us know. Hit that feedback button. Say, Edgar, I have a food you probably might like to try that you probably never tried before. Let me know. I'll come visit you at your area, and we'll connect with comida. Thanks, Brenda. Also, there's a step challenge, right? And so after you eat all that food, you got to kind of work it off somehow. And so there's a step challenge that I'm a part of as well. I forget
am too.
Are we in the same team?
No.
No. Okay, so we're not buddy here yet. Tell us a little bit more about the step challenge.
So the step challenge is this is the first one that we're hosting for the year. And we will be hosting a couple of other ones as we move forward throughout the year. So we're basically 1 week left into the step challenge this month, and we really just want to celebrate all of those participants who have taken the initiative to participate and really get stepping. We've had a total of 120 participants this time around. Very creative names for these groups. So you'll be seeing all of those emails go out with these olives of the folks' names, team names, and where they're at throughout the week. So we're just excited to go ahead and meet those new winners at the end of the month. And so if you weren't able to participate in this one, look out for any announcements for the future ones, and we'll be happy to have you take part of that step challenge.
How many staff are at Olive View Medical Center, would you say?
I have no idea.
Producers, how many staff? About 6,000?
6,000.
All right, 6,000 staff, and we have 120 participants.
120, yes. It sounds like a little bit.
Next event, we need to have a lot more. I'm part of it. In fact, I was with you one of the second week I was here, and we took a hike out in the hills, right?
Yep.
It's a fun thing. It's important. The winners will be awarded something real cool, right?
Yes.
I don't know.
We'll have first, second, and third place winners, teams, and also individual winners.
All right. Is one of them coffee with the CEO?
It can be.
Yeah, I don't think that's a good prize. Maybe they don't want to. Rather get a gift card to Starbucks. Whatever you guys need, we'll do. If you want to have Starbucks with me, I'll absolutely bring it in, and we can have Starbucks as well.
Yeah. And I just want to go ahead and take some time to acknowledge the person who's putting the step challenge together. She's part of the OVMC Wellness Council here at Olive View. Her name is Nicole Ulloa, and she's dedicated to ensuring that everybody is submitting their steps every Thursday. And we want to just highlight her for the work that she's doing, because there's a lot of work that goes on behind the scenes when it comes to totaling all of those numbers and averages and connecting with you all and gathering all of these prizes. So thank you for putting that together.
Thanks, Nicole, and I challenge you, so next time we get more participants. And I'm very competitive. I hate to lose.
Me too.
I'm very competitive. In fact, it's quite a walk from my office to the studio here, and so I went around 3 times before I got here. That's why I was a little late, to increase my steps. But we'll see. Hopefully I'm one of the winners. All right. There's a couple folks that we want to mention and highlight. We have a well-being council here, right?
Yes.
And the council exists to ensure that there's well-being events, but also well-being events for our staff, but also recognition of our staff, and celebrate those employees that really go above and beyond. Each episode we want to identify those folks. We want to highlight those folks that you feel deserve to be recognized on the View. Submit those through, and the Wellbeing Council is working on a process to do that. So, but we do have someone that we want to recognize, and you're going to help me with the last name, Christine. Okay, so we're both struggling.
Pronunciation.
I think it's Guib. Forgive me, but Christine from Patient Financial Services. she emailed me and she had an idea of doing this, and I thought that was a great idea coming straight from our staff member, Christine. And so she donated food to 2 fire stations, Local Engine Station number 91 in Sylmar and Local Engine Station 87 in Granada Hills. And as you know, we had the Hearst fire just down the road. The heroes that worked to contain these fires, to help evacuate our folks and keep everyone safe, were here during the Hearst fire. In fact, Dr. Waterman, Jessica, and Kim, we all came in, and also Celia. Big shout out to Celia for coming in. We came in that Tuesday night at about 11 p.m. and we didn't leave until the early morning the next day because we wanted to make sure that we were here for our staff to give them the latest information of what we had and how do we prepare should the very unlikely situation of an evacuation had to happen. The good thing was that, the winds were in our favor that night, and they actually blew the fires away from the medical center. And so we were assured, but we knew that this was going to affect our staff. A lot of our staff live in the surrounding communities. There's staff in U-Haul that were worried. There's staff in Santa Clarita that were worried about this and the closures. But again, the staff were so dedicated. I know of a nurse that was willing to stay over because we were short that morning because of closures or folks that had to evacuate, and she stayed over. So I want to thank each and every one of you for going above and beyond. I want to thank Christine for her great idea and her donations. You inspire us all. We couldn't be proud to work alongside staff members like Christine and you all healthcare providers that are here every day, despite the emergency and despite what's happening out in the community. So thank you very much. And needless to say, of course, let's keep up the amazing work. But I knowing coming in before I was hired here, I knew I was coming into a medical center that was dedicated to the patients and the community. And it made my decision to come here easy. And so let's continue that work, and I'm here to help you facilitate that. Brenda's here to help us facilitate that as well. And so any other announcements we want to make, Brenda?
As of right now, that's all.
All right, that's it. So this was your first episode. How many minutes are we in? Let's see. Are we almost at 30? 20? 23 minutes, almost at 30 minutes. This will be a 30-minute show. This is our first show. We're going to continue to improve. Let us know what you'd like to see in the show, how we can make it better. We're open to feedback. But I want to thank Brenda. Brenda has been creating this content, providing the outlines, facilitating the group. I want to thank Jeff Zito, our Chief Information Officer. I want to thank all his staff that have been, we have 5 people. Evan is here manning the camera. He's actually going to use the best filters to really make our faces look smooth and ageless. So thanks, Evan, for that. But I want to recognize all the hard work that you do on every single day. Again, I've been here for 3 months, and then not a week goes by where I'm not I hear of a story of a staff member. I hear of a facilities environmental staff that goes above and beyond the work. Again, the night of the fire, we had an electrician here 24/7, just at the standby because of the winds we were gusting up to 80 miles per hour, which are almost hurricane level type winds. And that's amazing. And power was going in and out. But Vince I think his last name is Gambino, right? Vince Gambino was here. I spoke to Vince a couple months ago, but Vince was here helping us with that. So thanks a lot, Vince, as well. But there's very many folks to thank that makes this medical center run at very high levels with a great quality of care delivery. I'm optimistic. I'm excited to be here. This is 3 months of many more months to come. There's a lot of ideas that here in the room collectively, in the leadership team, and the nursing managers, environment staff, facility staff. There's a lot of great ideas, and I want to make those ideas come to fruition, remove those barriers. But I'm calling you all to action. I want to encourage you to tune in, watch these episodes, be active in our feedback. when we visit you at bedside, when we have those executive rounds, share your feedback. Let us know how we can improve. I truly feel that it's important to hear you all and get your feedback in order that so we can improve as a medical center collectively. I encourage you to submit those questions. The next episode, we will be answering those questions live. We're not going to be cutting and then trying to figure out how do we answer. We're going to do it live and direct. That's how I'd like to do it. So submit those questions, keep them coming, keep those suggestions on how we can improve. But this says it. We're making history. This is the first episode. We're closing out the episode. I'm fulfilling my dreams of being a CEO and a YouTuber at the same time. I want to thank you. I want to wish you a happy new year. Some people don't like it when you say it like weeks after New Year's already happened, but we're in January. It's still okay. Happy New Year. Thank you for everything that you do. We will see you in 2 weeks on our second episode. Hopefully we'll have a lot of feedback and questions that we can answer here. And we're also going to show tons of pictures and we'll have videos ready for you to see as well. Thank you. And from the View to you all, stay safe, help each other, be kind to each other. And if you see me down the halls, help me find the cafeteria. See you later. Thank you.